Well, thank you very much, Samira, and good morning, everyone. A lot has clearly happened since the last NHS Providers Conference took place, including, of course, several changes of Secretary of State. And I know that might not matter to everyone in the room, as ministers do change, but I wanted to start by just assuring you that the challenges that you're facing are uppermost in the thinking of this government. And having previously held roles in Number 10, in the Cabinet Office, in the Treasury, one of the things I can bring to this role is making sure on your behalf that the very real challenges that I know you face will be given the utmost visibility in the discussions that take place at the centre of government. And in contrast to what some may have read in the papers over the weekend, I have been very clear in setting out the extent of those challenges in shaping the context of the Chancellor's statement to the House tomorrow. I'm very much looking forward to working with colleagues here and across the health and social care sector, which is an important part of all of our family story. And I am no exception in that. My very first memory as a child was when my mum was doing cleaning work in a caring home, and I went along, and part of the reason I remember it so well was the kindness of the elderly residents who used to treat me to lots of biscuits as a very little child and treated me so well when I was there. And that kind and caring environment has always struck and stayed with me. And I believe in explaining sort of how that has manifested itself. It is far better to show, not tell. And for any that care to look at my record during my 4 years as a member of the Public Accounts Committee, you will see that I was a very strong champion for NHS staff who raised issues of patient safety. Because I always felt very strongly that listening to and learning from staff is critical to improving outcomes for patients. Now, I know I'm speaking against an extremely difficult backdrop. We're all conscious of the fiscal statement from the Chancellor and the wider economic challenges caused by two once-in-a-100-year events happening within the space of 3 years in the form of the pandemic and the war in Ukraine. And indeed, that places constraints on pay and creates the backdrop of industrial action, along with the pressures you face as local leaders. And in these difficult times, I'm extremely keen to work with you on identifying all the practical measures that we can put in place to support the NHS and care workforce. And if I can make the point more explicitly, when people ask what my priorities are for the NHS, then supporting the workforce is first amongst those priorities. Now, we know that this will be one of the toughest winters in the 74-year history of the NHS. And I fully understand why a survey ahead of this conference by NHS providers showed that 85% of trust leaders are more worried about this winter than any in their NHS career. We face the twin threats of COVID and flu, the huge external pressures around energy and cost of living. We enter the colder months without the breathing space that we might usually have had over the summer, and I'm sure colleagues were more used to at earlier stages in their career. And due to the COVID pressures, which have remained high, that has continued that pressure. So there's a huge amount to do together to steer health and care through this storm and crucially make the changes that will make us better prepared for the future. I'm extremely grateful for everything that you have done so far in these difficult conditions, working hard to get more nurses on the front line and to meet those challenges. And we, within government, through our manifesto commitment to recruit 50,000 more nurses, are recognising the extent of those pressures and working with you. We'll do everything we can to protect the NHS this winter through the booster programme, more staff on the NHS 111 and 999. And within the Department of Health and Social Care itself, our focus is very much on what practical measures we can take to support you. As an example, when I was Minister for the Cabinet Office, I was surprised to discover that we had over 60 strategies across Whitehall just for science and technology. And there may be some here who feel they're often asked to contribute to long-term plans at the expense of time spent on more immediate pressures. Well, my focus will be on the areas that matter most to patients and workforce, and working with you on those practical measures of support. And so alongside workforce, our second priority will be on our recovery plan. With a backlog of 7.1 million, we will relentlessly focus on the elective recovery work that is being led by Jim Mackey and delivered by you as chief executives and chairs. Amanda and I want to see the department and NHS England working closely together on these shared priorities. And as part of that close working, Amanda and I are pleased to announce two important appointments today who will work closely across both the department and NHS England. So I'm pleased to say that Professor Sir Tim Briggs, who a number of you in this room will know very well, and who is one of the nation's most highly regarded orthopaedic surgeons, will bring his considerable clinical expertise to a new role as clinical lead for elective recovery across that programme, taking on a broader role as well as his leadership of Get It Right First Time and his clinical practice. I can also announce that Sarah Jane Marsh will be taking up the role of Deputy Chief Operating Officer and National Director for Urgent and Emergency Care. She will work closely with regional teams and integrated care systems to deliver our transformation of urgent and emergency care and make sure patients get the right care in the right place at the right time. Sarah Jane will replace Pauline Phillip, who I'd like to thank for her dedicated service since 2015. Now, initiatives like Get It Right First Time and Sarah Jane's work over the summer on the 100-day discharge task force sprint have been making good progress in better using data to prioritise and address variations in performance between areas. We took together an extremely positive step over the summer with the 2-year waits being virtually eliminated, and as we focus on the next steps of hitting the 78-week target by April 2023, we will work with you as trust leaders to more quickly scale best practice. Now, this summer I saw how problems often manifest themselves in one part of a complex system, but are caused elsewhere. For instance, I know that issues that we are seeing around delayed discharge are a symptom of a broader pressure across health and care. So to support this work, we have launched a £500 million adult social care discharge fund to help get people who do not need to be on wards and where this damages their health out of hospital and into social care. Today I'm pleased to announce details of the fund which will be provided to ICBs and local authorities to free up beds at a time when bed occupancy is at 94% and to improve capacity for social care. The first tranche will be provided by early December, and the second will be distributed at the end of January. In line with our devolved and data-driven approach, we will allow local areas to determine how we can speed up discharge of patients out of hospital, and this might be through purchasing supportive technology, through boosting domiciliary care capacity, or funding physiotherapists or occupational therapists to support recovery at home. Meanwhile, we will also be looking at the impact of how funding is used and using this data to inform future decisions on funding, including a more compelling evaluation capacity to help those discussions with the centre of government. Now, tackling delayed discharge must be an effort that spans a number of different areas across health and care, with social care, primary care, community services all working together with hospitals. I want to move away from blame being attached to particular parts of the system for problems that arise but are the consequences of issues that have arisen elsewhere in that complex system. So delayed discharge needs to be much more of a team effort where everyone plays their part and where decisions on where risk sits within a local system are best made by those closer to the issue. Equally, I am sure you can appreciate that quite often as a Secretary of State, being held accountable for individual operational failure, it can feel far removed from the day-to-day decisions made at a local level. And it is far better that variation in the different needs of demographies and local healthcare systems is reflected in more devolved decisions to local leaders, who, of course, are far better placed to assess the trade-offs about where risk best sits within those systems, rather than it being determined in some one-size-fits-all ministerial office. So a key direction of travel will be to empower the ICBs much more to harness advances around population-level data, with the role of the centre being geared around supporting areas to address those variations in performance, of which, of course, you will all play a large part. We will support trusts in stopping lower priority spend so they can prioritise areas that matter most to patients like cancer care. And we will also show more transparency from the centre about how our own resources are being deployed to ensure this spend better aligns with fewer targets and more ICB autonomy. We're, again, showing, not telling in that regard, and so providing transparency of department spend for the Department of Health and Social Care and our central arm's length bodies, which, it's worth remembering, accounts for £2.8 billion of spend. And the department, along with the vast majority of our ALBs, have now published searchable organograms showing all job titles and the number of people working in each team. So you, as health leaders, can see more clearly where resource is spent at the centre. And we can start a conversation about whether priorities and resource is best aligned with supporting you in meeting the challenges that your local health system faces. I'd like to touch also briefly on pay, which I know is an important issue for your teams. As in all sectors, pay is a central issue, particularly given the wider cost of living pressures. And I'm keen to work constructively with trade union colleagues, and indeed last week I met with the Royal College of Nursing, and yesterday I held a roundtable with a wide range of trade unions, discussing the issues that they raised on patient safety, non-pay benefits, and of course, pay itself. But I do not think it is realistic that increases should be 3 times the amount paid to those outside the private sector. And the over £9 billion cost this would entail would impact other areas of spend, such as buildings and technology, which are also important to staff. However, I'm grateful for the discussions that we had over the past few weeks and look forward to future discussions. And I've made clear my door is open and we want to engage constructively. And I can assure you that this is an issue I'm determined to take forward. Turning to GP access, which is another key priority. Because when it comes to people's direct experience of the NHS, over 90% of that experience is through primary care. So addressing the 8 a.m. morning scramble, opening access to appointments is a key area of focus and indeed was a key component of the plan for patients. We know there's no single solution, and we will be looking to ensure that we have a wider workforce for primary care. We'll be looking at the skills mix in primary care, creating more appointments for patients, rolling out the extra phone lines, looking at how we progress pharmacy first, exploring ways to do things differently, such as new areas like home testing, and redesigning patient pathways so that all the burden doesn't fall on GPs. Another priority is ensuring a stronger future for health and care in terms of how we use the latest technologies and trends to improve patient outcomes and to make sure that taxpayers' money is well spent. And one example of that is on the NHS estate. I know there are huge concerns about issues in terms of the rack concrete used in certain hospitals which needs urgent attention. And I want to speak very directly to the chief executives of all the hospital trusts that are affected. I understand the seriousness of this issue, and I am committed to delivering the government's commitment to eradicating RAC from the NHS estate. Equally, there has been great interest in the wider New Hospitals Build programme, and Saffron, I know that you've talked a lot about the importance of our capital programme to the longer-term future of the NHS, and I couldn't agree more. I want to use the opportunity of this biggest hospital building programme in a generation to think differently about how we approach the NHS estate. It's important to bear in mind that if you look at the last if you look at the last 10 hospitals, 9 of the last 10 hospitals built in England were over time and over budget. It interests me that, given where we are, 4 years ago as Minister of State in the department, I visited the Royal Liverpool Hospital, which I was told 4 years ago was near completion when on my visit to that hospital. And then 4 years later, I'm now visiting again today, with it only opening last month. So there is an urgent need to change how all NHS buildings are constructed in the future. And this means moving away from bespoke designs by local trusts, and instead having national standardised designs built through modern methods of construction, where the construction time on site is much quicker, the operational performance is delivered quicker, the environmental features are better integrated into the build, and the central evaluation process within government, which to date has been a sticking point for many trusts, can be streamlined because of the greater consistency of design. Whilst COVID has left us with many challenges, it's also shown us that there are new ways of working which could apply. And one of the most important of those opportunities is around better use of the NHS app, which should be much more central to how people access health services. I very much welcome that so many GPs are now making their patient records and testing results available on the NHS app, and I think there are significant opportunities to harness the NHS app further, particularly around the context of pressures in primary care, but more widely on preventative medicine, and we have some big updates to come, including from the end of this month, allowing people to book their COVID jab through the NHS app. But I also want to look at how we make greater use of patient data in a safe and secure way to power life-changing medical research and cement our nation's status as a science superpower. I want patients to have more opportunities to share data on an opt-in basis, to support our great universities, startups, scale-ups who are making incredible breakthroughs, and through cloud computing, machine learning, and the Internet of Things, allow for data to be used and interrogated in new ways. This can give us a competitive advantage when it comes to attracting tech pioneers and researchers in the future of health, but also help us deliver more effective, personalised care for patients. This has to sit, of course, alongside basic improvements, like the electronic patients record being rolled out more quickly, and the poor Wi-Fi coverage that remains too often a frustration for staff. No one is here, I'm sure, is in any doubt as to the size of the challenge that we collectively face. We have to deal with pressures from flu and COVID this winter, substantial backlogs from the pandemic, the wider cost of living challenge faced by our workforce. And so as a result, my key areas of focus in the months ahead will be first and foremost supporting our workforce, focusing forensically on our recovery plans across electives, urgent and emergency care, including the issue of tackling delayed discharge, and primary care access. Alongside this, we need to fix the issue in terms of the RACs, and we need to maintain momentum on the New Hospital Build programme, in particular, streamlining the central approval process, and invest in tech so we can make it easier to deliver good patient outcomes and better harness our approach on preventative medicine in a way that incentivises patients to provide data for our scientific community, who in turn enable those treatments to be personalised and pathways to be streamlined. I will play my part to try and reduce the number of top-down requests that you face, devolve decision-making to a greater degree, and allow those closest to the patient to better balance how risk is addressed, given the complex landscape in which you all work. And I will set a much higher bar within government to any new legislation, which so often creates undue distraction. Thank you once again for everything that you do. I'm very much looking forward in this role to working with you to build a more resilient, healthier NHS for the long term, so that collectively we can give the security to the people we represent and knowing it will be there for them when they need it most. Thank you very much.
Thank you so much, Secretary of State. I'm going to take questions from you in the auditorium very shortly. Just two things I wanted to follow up that were in your comments just now. One is obviously this whole issue of hospital discharge. You mentioned more resources for NHS 999 as well as 111. Ambulance trusts are working flat out to deliver for patients, but the patient flow through hospitals is so challenging. What action are you taking to ensure that those people who are medically fit to be discharged are able to return home or get to an appropriate care setting?
Well, that was one of the key things I was seeking to address in the remarks. Firstly, the 500 million, which will allow us to do much more, particularly in areas like domiciliary care. And it's recognising that what manifests itself as a problem in ambulances is often caused elsewhere in the complex system. So it's the blockage in the pipe in terms of delayed discharge that is then creating pressure on the hospitals, which then manifests itself in unmet need actually from ambulances that are not able to get out to the patient. So part of it is being clear within government and the additional funding to target delayed discharge and working with the local authorities as well as the ICBs in terms of how we get a better sense of the flow of the patient through the data and integrating that data but financially supporting that. It's also then looking at the other areas where blockage occurs, so the pressure on the A&E, where risk sits in the system, how we have better demand management upstream. So the point being is what often will drive sort of media inquiries is the ambulance that's unable to turn up or the very long handover delay. But I think colleagues in this room will be very clear that actually the cause of that is often elsewhere in the system. It's the delayed discharge, which is in part social care, but not solely social care. And sometimes one can see, for example, in hospitals that at the weekend discharge drops. So the question is what is within the trust sound control, pharmacy, consultants of the weekend, what can they do? Often you get specific issues, palliative care, dementia, Parkinson's, so it's a question of being quite targeted. What are we doing on the mental health side as well? So there's often a range of factors, but it's the ambulances that often dominate the headlines.
Yeah. Other big issue, one of many, is the high number of vacancies in the NHS. What steps are you taking to address those? And particularly, you're very aware of the need for long-term rather than short-term planning. Yeah. Can we expect to see a fully funded long-term workforce plan in the near future?
Yeah. No, it's an absolutely fair issue, and it's something I absolutely hear from colleagues is a key thing that came up with my discussions with the trade unions. And so, again, there's no single sort of magic bullet on that. It's a range of things. So one of the things in terms of the immediate pressure that I did in the summer during my short time was to really look at how we boost international recruitment. It's not the long-term solution, but just as a recognition of those immediate pressures. Obviously, we are recruiting more, 9,000 more nurses than last year. We opened 5 new medical undergraduate schools. That was one of the things the Chancellor, when he was in my role, did. So we're trying to boost that, but that obviously takes time to come through. We're looking at how we best use the full skills mix. So if in GPs, for example, what are the things that don't necessarily need to be done by the GP, and how do we enable people to operate who have got a range of skills and get patients to them. It's looking at what we can do in new pathways. So we saw the announcement from Amanda in terms of GPs directly referring to diagnostic centres. I mentioned in my remarks looking at the opportunities around technology, around home testing, and how that can then look at different pathways. Of course, there's work by people like Tim Ferriss around on the tech side, and there's work streams on machine learning and other areas where that can relieve pressure. So the point is there's a whole range of things we need to do. I absolutely hear from colleagues in terms of the pressure on workforce, and that's one of the areas we're really keen to work with trusts, with local leaders. I think we all recognise that some of these things take time. It takes 10 years to train a GP, so some of these things take time. But what are the things we can do that allow staff? And again, I mentioned Wi-Fi. One of my visits in the summer, it's quite interesting. The surgeon was saying we're wasting 15 minutes every Monday morning waiting to upload our images. So it's just thinking about where are the things which are taking time from staff, not enabling them to do what they really want to be focused on, and how can we work with local leaders to get the right prioritisation into those areas.
One thing that came up yesterday just on nursing in particular was bursaries and financial support so that they're not worried about student debt.
Well, part of that is then a question within the things where there's a cost, and there is around bursaries. Likewise, government's very committed to apprenticeships and looking at how we get more apprentices in. And again, one of the challenges then is usually around backfill and the costs of that. So part of it is working with local leaders around the prioritisation. Where do we get the best bang for the buck? What is it that we want to prioritise? And the point I was making in the context of pay is actually, it's not simply pay is an important issue, but obviously the estate, tech, some of the other issues are also factors that impact retention and recruitment. So we've got to focus on the full gamut of those.
Thank you. So in the time we have with Secretary of State, nice brief questions, please. If you want to put your hand up, we'll get a microphone to you. I can see there's one down here near the very front, but put your hand up. Number 1. Have you got one there? Somewhere? Yes. There was definitely one down here, number 2. We'll take number 2 first if you're ready. I saw a hand down near the front there, somewhere otherwise. Yes, go ahead. We'll take number 2 first. Thank you, and then I'll take number 1. Hello.
Hi, I'm Georgina Dean from Black Country Healthcare. Very disappointing that throughout your speech you didn't make any mention of mental health, and it wasn't on your list of priorities. Given you also said that there'll be less funding for low priority areas, should we be worried about the mental health investment standard and less focus on mental health?
Thank you.
So mental health, of course, is critical. It's partly why the government is boosting funding for it. It's something that Theresa May had particularly focused on. Probably one of the NHS England leaders I meet most frequently is Claire Murdoch in my sort of brief tenure. So I've had a series of meetings there. We're very focused on mental health, not least in light of the urgent question last week and some of the issues that arose in inpatient units. And one of the things I've been talking to Maria Caulfield quite a bit around is the paucity of data to better sort of identify those issues in terms of those inpatients, and we're looking very closely at that. Also, of course, workforce actually in mental health has increased. I think 16% over 4 years from memory, but colleagues in the room will know the precise figure, but certainly the increase there. And we've more to do, but we've got a quarter of the schools now covered in terms of the mental health support, because again, I think one of the things we recognise in mental health is around half of cases, I think around 50% of cases manifest by the age of 15. And so one of the things on mental health is getting much more focus on early care, early support and prevention. I think it's a bit like with any speech, if you go through every area within, it becomes, at least what I was trying to give a sense of is, within workforce, obviously mental health is part of that workforce. And part of the urgent question and the issues we're looking at is, what are we doing across the workforce? Now, I didn't list every single item of every area of workforce, but obviously the mental health workforce is a key component of my number 1 priority. So, there's a lot of work. Parliament was focused on this last week. I had a series of meetings over the last week on mental health, and I've commissioned work, as I say, through the relevant minister in my department, particularly looking, in fact, I was having text messages on it this morning, just in terms of the inpatient care units and what's going on there.
Thank you so much. Number 1, am I right? There was a question with number 1, or did I imagine that? Right. Right, we've got another one, number 2 down the front here. and then I'll come to number one. Sorry. Yeah, go ahead.
Hi, James Owen from Health Service Journal. You suggested at the beginning of your speech that the reports over the weekend that you've been arguing to the Chancellor that the NHS does not need more money were wide of the mark. Can you just clarify your stance? Because obviously that was quite a significant briefing on the NHS's financial position and whether it needs more money to help counter inflation. Obviously, it's the autumn statement tomorrow, and not expecting you to sort of preempt any of that, but just in terms of your view of whether the NHS does need the extra funding or not, just to sort of clarify after the confusion over the weekend.
Thank you.
Good. Well, it's a great question, and I'm very pleased to have it, because actually it's a great proof point for colleagues in the room, because for those that read the story, they said that it was my view that the NHS didn't need any more money to meet inflation. Firstly, that is completely incorrect, and we had told the journalists that it was incorrect, but the story was wrong nonetheless. And the good thing about this, Samira, is colleagues in the room will be able to see tomorrow. So I can assure you the Treasury wouldn't allocate any money to the department if the department said it didn't need it, given the fiscal situation we face. So in short, of course, we face significant financial pressures. And inflation is there. I've been having a lot of discussion with Amanda and Julian over recent weeks. I've been having a lot of discussion with the Chancellor. I think actually one of the things I'm able to bring to this role, having been Chief of Staff in Number 10, having been the Minister responsible for spending in the Treasury, and having been the Minister for the Cabinet Office, is actually a very good understanding as to how best to make the case for the Department of Health, and also in terms of our care sector, in terms of making that case to the centre. So firstly, I can absolutely confirm that we do need support to meet those inflationary pressures. And secondly, coming back to, I said in the speech, show not tell, and I think it's probably just useful for local leaders, because sometimes I'm sure in my tenure as Secretary of State, things will be written which won't reflect my view. That's kind of goes with the train in politics. And perhaps it's useful when you see tomorrow whether it is true that we don't get a penny, and I've not asked for a penny. When you see tomorrow whether that is true or not, I hope you'll just bear that in mind when in the future you also see stories which may not completely align with what we're doing in the department.
Thank you. I want to take one more question, number one. Thank you.
Jack Tarsing, Coventry and Warwick Partnership Trust, Mental Health Trust in the Midlands. I'm going to be cheeky and ask you two questions.
Oh, no, just one question, please, just
they're going to be short.
To be fair.
Number one, capital. Decades of underinvestment in capital is leading to inequalities and poor patient care. The second one, can you assure us the government will speak with one voice around health inequalities, which will drive some of the efficiencies if we're given the funding to deal with inequalities, that will deliver efficiencies.
Thank you. So a question about health inequalities.
Health inequalities is something that really interests me, because I represent an area in the Fells where the health inequalities compared to Cambridge are very stark. And I think the key there, firstly, is that we're very data-driven and make sure that we're better aligning our targeting of resource with where they're most needed, and being, so having a very data-informed approach. And that means looking at things on a population level and working much more closely with the ICBs to empower them to then target that health inequality. And things like the Federated Data Platform obviously will be an important tool to do that. So I think the health inequalities issue is hugely important. I think that also is really important to a government that is committed to levelling up. But also, and I'd perhaps relate it to this thing about making the case more effectively to Treasury. So I think one of the things, in my view, is making that case on levelling up and health inequalities in the context that health is actually a barrier to economic growth, because it is leading to a lot of people being out of the labour market at a time when there are constraints on labour supply. Now that's a different argument to, I think, sometimes the way the case has been made to the centre before, but I think it will be a more effective argument rather than it being simply a health case. Actually, what we're making is a much wider case on health and economics. And I had a very good discussion with Andy Haldane, for example, last week, with his Bank of England background and DLUC background, about how we actually make a wider case that it's a health case, but I think we're more likely to get support by actually also demonstrating the wider benefit to the economy.
Thank you. Thank you for your questions. Thank you so much, Secretary of State, for coming to address NHS providers today. Thank you again.
Thank you.